Hi rehabbers, it's Kevin from the Rehab Revolution teaching channel, and this week's learning is going to be the first episode in a series of about 6 or 7 training sessions all about evidence-based practice, in particular how to make sure that we are using best evidence for the treatment of our patients, and basically how to come up with a research question, how to create a research strategy, look at the databases we'll use, look at the limitations that we'll need, look at the hierarchy of evidence, bring everything together, look at the biostatistics, and then come up with summaries that can change our practice, and also then how to assess whether it's worked. So this first part is all about creating a research question and then using that question to come up with search keywords. So this training is going to be slightly different in that all the way through, from the very first talk to 7 or 8 talk, 7th or 8th talk, we're going to use a real example and the same example, so you can see the different stages in action. So this one is a very common one. So we've got a patient comes in, has had a private MRI scan, and this shows a meniscal tear, and the patient comes to clinic because she wants surgery. And obviously what we need to look at then is, well, does she need surgery? Because she might, depending on the symptoms. But doesn't she, what does she need, and where we need to get the evidence from. So this is how we create our question. So using the PICO terms, we have here the P is for population. So in this case, middle-aged adults with symptomatic meniscal tears. Now what we need to do is come up with alternative meanings of the same words, because sometimes different search engines will only look for meniscal tears, for example, and it might be under something else. So in this case, meniscal tears could be degenerative meniscal tear or degenerative meniscal injury. Middle-aged could be obviously middle-aged or age between. For the intervention, we want to know, does the patient need surgery? So the terms we need to look at are things like surgery, arthroscopic partial meniscectomy, knee arthroscopies, meniscal repairs. Well, comparison, because obviously what we want to know is, do they need physio or do they need surgery, is the conservative management. So this could be rehabilitation, exercise therapy, physical therapy, non-surgical management, physiotherapy, or conservative management. And then what we need to look at then is the outcomes, depending on what's important to the patient. So pain reduction, functional improvement, return to work, return to activities, return to sport. So what we look at there are things like pain reduction, VAS, NRS, return to work, return to play, return to sport. Now the other things you can see here are the words or and the words and these are what we call Boolean operators. Now the other word that should be here, and we don't need it in this case, is not, is another Boolean operator. So when would we use these? So if we are doing a search of 2 terms and we've got the word and, then it will find results with both sets of research terms. So in this case, box 1, 2, 3 and 4, we've joined them with and, so it's going to pick up evidence or literature that shows all of this. Now the other one is or. Now or, where are we here? It's just there. So or will find results with either term in them. So for example, it will be looking at middle-aged or age 35 to 60. The other one we've got is not. Now this excludes a term. So if I use something as an example, so for example, if I'm looking at football injuries and I want to know about ACL tears in football. Now, if I put football, not soccer, it will come up with injuries in footballers. But then it will miss soccer, which is another term for it. So that is how you use the not. So following this very brief presentation, you should be comfortable in using the PICO framework to help create your research question, what Boolean operators are and how to put them in, and then how to create search keywords based on your research question. I hope you found this useful, and I'll see you next time.